Hi, my name is Randy Blamas, and I am a therapist in Rockland County, New York. A little bit about backgrounds, and then I'll go into some of the content. This video is for therapists. Please, masters or doctorates, only in that they're the people that I want to see doing it because of the private practice and or agency practice, and hopefully they know how. I have a master's in psych, master's in social work, licensure in clinical social worker in Rockland County. I also have certifications in hypnosis, international, federal, and state certifications in addictions with alcohol and substance abuse and others. I'm a member of the National Center for Crisis Management, American Academy of Experts in Traumatic Stress, and the American Psychotherapy and Medical Hypnosis Association. Mostly I'm Randy. The other data is just to kind of say that I have a background. I have worked with people with trauma prior to 2011, but significantly, 2001 and 9/11, but since then have done so frequently. What I'm trying to boil down to is several things. One, my hope in putting a CD of YouTube out is that there can become an integrated network of therapists that know what they're doing around trauma, so that those people can be the experts in their area. I have no problem getting feedback, consultation. But again, my fear is of them not getting covered. My goal is to make sure that it's not just trying to fly by night or people not knowing what they're doing. 90 to 95% of people come in with trauma and PTSD haven't had it addressed with any therapist they've met with. When I find a set of symptoms, I provide education first. So I'm giving you my model. I talk about symptoms of PTSD after I've elicited that that's there. Let me back up. If I have a carter or a carver, or somebody burning himself, if I say alcohol or drug abuse, anorexia or bulimia, if I see compulsions or addictions that never seem to make it past a year, then I just check into that area. So, these clients who will go through being triggered by whatever symbolic or other areas are going. In this case, for example, waves, a boardwalk that's not there, loud sounds, things that get recorded from what they've been through with the hurricane and losses and all the other feelings. I'll find that they will get triggered in the present from something in the past, for example, the hurricane, and possibly even previous trauma. And it will come out in anxiety attacks, panic attacks, depression, acting out in other ways, whether it be sexual abuse, sexual, alcohol, drugs, compulsions, addictions, pacing, OCD symptoms, changing in communications, withdrawal. All of those behavioral manifestations. With kids, sucking thumb, bedwetting, regression to early behavior, that we need to keep an eye out for those types of symptoms. The type of treatment that I do is kind of a eclectic mix of some psychodynamic in terms of subconscious and conscious, and helping to get an idea of what's going on subconsciously so that we can work with it. Behavioral, definitely in terms of family systems, they're using that. And in that, strategic, structural, and communications coming in that way. I very much am cognitive behavioral and big on education. I find that when I meet with the client, even in the first session, after I know that they are meeting the PTSD criteria, I go over it with them. And what winds up happening is anxiety that they come in with goes down because of the fact that they're not nuts. They see what's going on here at the PTSD sheet that I'll read to you in a second. And then I explain a tank that they have, that they can put things that they've been repressing or traumatized with, put in the tank, which is normal. I don't want to think about it. I don't want to talk about it. I just don't want to think about it. I don't want to talk about it. And that tank gets extremely full. And I tell them, I'm not going to break open the tank. I'm not going to dig. I'm not going to do anything with that tank except when you're comfortable with that you'll open it and close it. You are in control. And I reinforce that they're in control because I don't want them to feel re-victimized, treated again. So in the first session, we've educated, we've framed out the work, and then we wind up using, with me, hypnosis. Prior to that, empty chair and other Gestalt techniques, but I love hypnosis. And for those of you knowing EMDR, that also can be helpful. So it's very much an approach that comes from a number of different directions. Whether we're using EMDR or get a training in hypnosis, we're dealing on those things as well, on multiple levels. Because there are things that they're not aware of. For example, all men are unsafe can be the conclusion, but at an unconscious level, and sometimes, not even sometimes, when they're ready, by raising it up, we can help them to recognize who's safe or not, because we still want them to have a detector for bullshit or what doesn't fit. I'm going to read some of the symptoms that I have down on the website. Just to give an idea of PTSD, I'm going to skip over an awful lot of when they are on the website at har-bor.com. That's har.bor.com. And just in case I get rushing on the sheet, you can reach me at 845-354-9200 or by cell at 845-821-1635. Some of the physical symptoms are, again, more acute when first they chest pain, difficulty breathing, elevated blood pressure, heart rate goes up, possibly can be some thirst, dizziness, profuse sweating, fight or flight responses. In the cognitive area, they can feel like blaming someone, confusion, poor attentions, poor decisions, heightened alertness, poor concentration, memory problems, hypervigilance, difficulty identifying objects or people, poor problem solving or abstract thinking. If it's severe, loss of time, place, or person, disturbed thinking, and intrusive images. That's where they think something, oh, what the hell is that coming from? It's not a delusion or hallucination. It's more of a, playing out, it could be anxiety and guilt, denial, panic. It says rare on my sheet. It's not rare. It's frequent. Not frequent, but it says there a lot. Emotional shock, feeling like they're crazy, reacting and not knowing why they did so, apprehension, intense anger, and irritation. Change in speech patterns and withdrawal can be there. Emotional outburst, loss or increase of appetite, alcohol and food consumption, as can anorexia, bulimia, compulsive gambling, compulsive sex, others addictions. There's a lot of ways that they try to self-medicate. Inability to rest, hyper-alert environment, that hypervigilance, that dissociation, or shutdown feelings, not being able to stop at all, pacing and erratic movements can be there as well. Again, if you wish to reach me, 845-354-9200 or at harbor-press.com, Randy at harbor-press.com. And if you distribute this, what I'd love to see is an integrated network of clinicians that we can make sure to cover those areas where people don't need help, because they sure as hell will. It's just a question of for how many years. Take care.